Hello, everyone. This is the Ophthalmology Business Podcast, where we help you develop your ideal practice with help of other doctors and experts. The topics we cover include marketing, management, leadership, recruitment, HR, mindsets, and more. I am Narain Arul Raja, the founder and one of the co-hosts of this podcast. Every listener of this podcast is welcome to join the Ophthalmology Business Academy, www.obacademy.org. The membership is on us, and it's our gift to you. Today, I'm excited to talk to Dr. Alvarez. Dr. Alvarez is an internationally renowned ophthalmologist with over 22 years of experience in comprehensive ophthalmology. Her passion is around what we call universal eye care or global ophthalmology. And she advocates for the provisions of eye care as a basic human right for all populations. She currently practices as a general ophthalmologist at Emory University. We are thrilled to have her share her knowledge and insights on universal eye health with us today. So our topic today is universal eye health. Before we jump in, I wanted to ask you, Dr. Alvarez, to take a minute or two to tell us a little bit about yourself. Who are you? How did you get into ophthalmology? And of course, kind of help us, walk through from the time you graduated from your residency, you completed your residency, and to where you are today.
Hello, how are you? Thank you for having me and for the invitation. As you say, my name is Julibeth Alvarez. I was born in Venezuela, and I moved to the United States in 2003. And I complete my medical school and my training in ophthalmology in Venezuela. And I moved here based on all the political, social, economical situation in Venezuela. Having small kids, you are looking for a better future for them. So my husband and myself, we took the decision to move here. And it's funny because at the beginning, we decided that we were going to go into something not related to medicines. So we bought a restaurant. And it was also in order to get all the legal papers in order. So we obtained a USA residency. So once we obtained it, we decided that we were not complete doing something else. So we starting for the steps. And in the meanwhile, I was working as a ophthalmic assistant in a private practice. And once I complete my steps and I obtained the ECFMG certificate, I went to Puerto Rico for 1 year to do what is called here postgraduate year one, which was an internship. And after that, I worked as a general practitioner for 5 years in the underserved areas. And after that, Florida Medical Board granted me an unrestricted license. And I went again into ophthalmology, doing my first fellowship, which was in comprehensive ophthalmology, which was kind of reacquainted with everything because I was practicing general practitioner. And I stayed with that practice for 5 years doing comprehensive. And then last year I took a leap of faith. My passion has always been volunteering, global ophthalmology, community services, and then I applied for the global ophthalmology program in Emory, the fellowship, and that's what I've been doing this year. And actually, it's been so fulfillment that the fulfillment that I have achieved during this year is I always describe it as falling in love again for the reason why you became a doctor.
Yeah, especially like helping people who don't have you come from Venezuela, so you understand, it's a different world, right? Some people have so many opportunities, so many benefits, or, ways to, prosper, take care of their health, etc. And some don't.
Yes.
So you, having come from that, and I assume your kids are now grown up and they are no longer like taking up a lot of your time. You wanted to kind of give back and help to the people who really need the help.
Exactly. So before I didn't want to commit to something that I really can put time into it. But my youngest is going to college this year. So Yes.
I hear you. I'm kind of in the same boat. My oldest is in college, and my second will be going to college next year. So it's like, what next, right? Like you need a purpose. We
Exactly.
hopefully nowadays people are living long lives, so you need like a part two, like chapter two of what to do with your life. So that's awesome.
Exactly.
Let me jump into the interview. I have a few questions that I want to go through and get your take on it because you have experience and knowledge. What inspired you to pursue a career in ophthalmology? And we already talked about it. And specifically, like working globally. Like, is that because you saw such a big gap between the haves and the have-nots in terms of their eye care? Is that why you kind of wanted to help people on a global basis, especially the ones in middle income and low income countries?
Well, yes, I have to tell you that what I work in an underserved area for 5 years, so I know that even in our own backyard here in the United States, we have so much need in all the fields of medicine, not only ophthalmology, and then providing care for people who is in need and sometimes don't have the resources. And I'm talking about not only like the supplies or the equipment. Sometimes it's either the lack of skilled professionals, skilled or trained staff. So it's one thing that brought me to global ophthalmology. And I have to tell you, this year has changed my perspective completely, because I know that sometimes you see global ophthalmology that going to place, do volunteer, do surgeries, and actually is a collaboration from both sides. You're learning, they're learning, and you are helping them with the resources that you have, and then teaching you to work in an environment, and you don't have all the things that you have available right here in a high income country. So, and also it brings you to the academic side, because you are teaching people, and not only the residents or the fellows, but also the staff from technicians, nurses, that can be of a great assets in the field.
Absolutely. Makes sense. So let's just get into some of the meats of our conversation today. Like, how can you or us or anyone in ophthalmology help address the inequities and the disparities in eye care services, both locally within the United States and of course globally?
Okay, so well, there is always the option of donating money. So it could go to the NGOs or the programs that are taking care of those programs that are abroad in other countries, that you can take equipment, medications, and even complete teaching trips or mission trips, that I don't like to call it mission, but more like brigades. They can go there and teach techniques to the personnel over there. You can get involved in the local, local, in your local community, through different organizations. It depends on the state. For example, in the Dr. Ovanion, which is the program director of Emory, she is doing what is called Georgia Vision Network, who is trying to build a database of all the eye care providers across the state, so people can get access to that. So there is students, there is people from the community working on that, there is people from Preventing Blindness and different organizations. So you can either volunteer your time, you can donate your money, or you can get involved in in kind of awareness. So if we don't know something, we can be conscious about how can we help. So bringing into attention of the people that blindness and vision impairment is really a problem that not only affects a person, it affects the community, the family, and even the country in terms of productivity and the years of the quality of life of the person can can be of a great advantage to. So I will advise people that not only contact your community, but also, like, for example, Help Me See International, Orbis International, and Prevention Blindness, and to be aware of what are the opportunities for you to help.
That makes sense. Can we talk about the significant challenges that ophthalmology faces, specifically in low and middle income countries, and how organizations today help address these challenges?
Okay, so the organization, what it usually is a collaboration between two parties, one who is in the country that we are going to work with, and the other is from the people who is like organizing the whole program to help over there. So you can have many ideas, but you have to work with them to really understand what are the needs. So we do a collaboration, and there is like, we have to plan before going. And then when we are there, knowing what are we going to do, we have to set up the infrastructures and the equipment, and work with the doctors, nurses, or technicians that are in the country to complete the mission. For example, I can give you an example in the project that we have been working this year, which is with Honduras. Since my maternal language is Spanish, it's been easier. So we work an NGO which is called ACE Global, and with the Hospital San Felipe, which is the place where the ophthalmology residency is located. And then we have been doing trips for lectures for the residents and for the fellows, and also doing kind of brigades when we the residents they made a pool of patients, and then when the experts go, for example, if their specialty is cornea, so they do, and they teach the residents and fellows to do the cornea procedures and surgeries.
Makes sense.
And important is because the care of the patient in the post-op period. So you can go and make a surgery and just leave it like that. It has to be somebody there who is going to take care of the patient in the post-op period in a long-term follow-up.
Right. Can you share a success story or even a memorable experience from your work in universal eye health or global ophthalmology that
Yes.
kind of showcases perhaps the impact and the difference it can make?
Yes, of course. There is, for example, a lot of young patients in the 40s or 30s that have very advanced cataracts, that they fall into the category of blindness. I mean, they're seeing more than 2400. And those patients, this especially was a lady who was 42 years old, and she has been in her house for the last 3 years, very depressed because she couldn't go out of the house without help. She couldn't, produce an income for the family. She felt like she was a burden. So she was very depressed, even like thinking about ending her life. And in one of the brigades, they did the bilateral cataract surgery. One day we did it, and the other one we did the other eye. And she was a completely different person when she regains her vision. So this is one of the many histories that you have, and probably it sounds cliche because you're gonna read it in every article or interview, but it never gets old. It never gets old. It's like a miracle. If you regain your vision, it's a miracle for the patient.
Right. What are some of the cultural differences and language barriers that impact the work in global ophthalmology? And how does one navigate it? Let's say, I'm like most people and I only speak English.
Mm-hmm.
You speak Spanish, which is
Mm-hmm.
awesome, but many perhaps don't, right? But they still want to help, or any other language for that matter, right?
Mm-hmm.
French, etc., etc. So how can one help and navigate all these cultural language challenges if they still want to get involved in global ophthalmology?
Well, my experience has been that most of the people that is involved in this type of action or programs, even at the local and low middle income, they speak English, or they try. So we communicate in English. And but I would recommend, if you're going to a place, at least try to learn the basic. Just at least hello, good morning, have a good day, how are you feeling, look up, look down. They feel like you're interested in them. And sometimes you have to be aware of, for example, one of the things that is we as the Hispanic population, we are very affectionate. So we can hug you without any warning, and that is not, well received, or is not appropriate in other countries. So you have to, educate yourself once you're going to a country or a place that you know aware of what is right, what is wrong, what is considered, educated. For example, for women, sometimes if you go to some places, you have to be aware that you have to wear long sleeve because you're not supposed to expose some parts of your body, or probably you can be alone in a room with a person of the other gender, so you have to have something. So those kind of stuff, you have to educate yourself. Most of the time, people is just very welcoming because they feel like you're helping. So they're not going to be, trying like malingering. They're just very grateful that you're there to help.
Right. What are some of the essential skills and qualities that you think healthcare professionals in general, and even those in the ophthalmology field, need to develop or have, especially as they get more and more involved in this type of work, universal eye health or global ophthalmology related work?
Yes. Well, if you are a comprehensive ophthalmologist, you're going to be fine, because you're gonna have the skills to do a comprehensive examination. And in terms of surgery, so I will advise that you get certain training in manual small incision cataract, because in some countries you don't have the phaco machine available. So the main surgery, or the main technique to use is the manual small. And also if you're treating glaucoma, so you don't have access to the mix or to, the tubes. So probably trabeculectomy is one of the skills that you will want to, be proficient in terms to help people with glaucoma as well.
Right. I have a question, a personal question. How has your involvement in global ophthalmology impacted your career in ophthalmology?
Okay, yes, it hasn't, as I've told you before, is like having all this passion that you have when you start doing something that sometimes it starts to wear off, like with a routine. Right. And the impact, first, I have learned a lot about all the needs that are over the world, and even in the United States, that I wasn't aware of. Second, there is many opportunities that you have. Okay, so even if you think that you don't have the skills, you will have some skills that will help, like teaching people, being an advocate, just spreading the word. And also have developed skills, not only in terms of surgical skills that I have learned a lot, like the manual small incision cataract, but also I have learned in terms of communicating and interacting with different cultures. I see myself in the future, like, spending a lot of time doing related activities to global ophthalmology.
Oh, thank you. That's awesome. Now, last question before we go. Let's say I listen to this podcast and I'm inspired and I want to get involved. I want to make a difference, at least in a small way. How can I start?
Okay, so you can start by going to the American Academy of Ophthalmology. There is a section, a link that takes you to it's a guide course through global ophthalmology, from the basics, how you can get involved, all the basic concepts about epidemiology, because you have to get you gather the data, and you have to know how to evaluate and analyze the data. So that will be one step. The second step is that they do also have a volunteer area that you can go and see what are the options that you can volunteer either here in the United States or abroad in another country. And the third thing that will do is sometimes in your community, maybe it's a Lions Club or a Rotary Club that they can do like these health fairs. So probably, working with them to see how can you help in doing some type of screening in your community. That will be a small step. So I live in Miami, and right now I'm here in Miami, and I'm talking with it's a free clinic which is located about an hour from my house, and I'm talking with them to see if I can go and do volunteer at least once or twice a month, so I can see patients. So that I think it could make a difference. It's good for me, and I think I feel good that I can help people who doesn't have access to the eye care services because they lack of money, or they don't have their own insurance, or they think because they don't have the legal status right here in the United States, they're afraid to go to any other place.
Right. Thank you so much, Doctor. I really appreciate your time today and your insights. It's definitely inspiring. I think what you said at the start and what you ended with is, this kind of reminds you why you became a doctor in the first place, to help people. And of course, it's no better feeling than helping those who really don't have access to care, right? So, and in the process, you become a better person. You learn so much about cultures, about people, about challenges, about creative solutions. Like you said, they don't have the technology that the average doctor in the US would have. So how do you function in an environment where you don't have the technology? They don't have the people who are as trained as somebody that you work with here. So how do you be part of a team where not everyone has the same level of expertise? And how do you maybe even impart knowledge? You are becoming a mentor. You are helping them. Not only you are just solving the problem for that one patient, but you're also like helping those people on the ground, get better and deal with things they were not able to deal with before. So I think it's really fulfilling. And I know it's not like, oh, it's all solved and everybody has perfect eye care. I don't think, that's going to happen anytime soon. But at least even if you come closer to that goal of, making things better, even one person at a time, I'm sure it's very rewarding. And I really commend you for everything you're doing, both on the field and now, with us here, like inspiring and educating others who want to do the same thing. And I think also your life story is fascinating. I mean, you came from a challenging place and it's still challenging, right? Venezuela.
It is.
So kind of, I think you appreciated things a lot more because you came from that environment. So, and sometimes, all of us, or even my kids, or even your kids being brought up here, they take things for granted. They don't realize that how lucky they are. So, so sometimes it's nice to know that, we are privileged and we need to take our blessings and hopefully do good things with it. So thank you for your time. Any final comments as we wrap this up?
Well, again, thank you for inviting me. It's been a pleasure to meet you and to talk to you. And I'm just hope that they can inspire people to join us in this, in this brigade of preventing blindness and helping people to regain vision, because it's actually like worth it, definitely. And always stay humble. That's another thing.
Thank you so much, Dr. Alvarez, for taking your time today to talk about universal eye health. I also want to take a moment to thank our listeners. We appreciate each and every one of you. We cannot do what we do without you. If you like our podcast, please share it with your friends and on social media. Also, please don't forget to write a review on iTunes or Google Play. Your reviews will help other doctors and practice owners find us. Till we meet again, wishing all of you an amazing week ahead.